Hello, I'm Kochanski, Wilderness Living Skills Instructor. I teach survival occasionally as well. And the issue here today, the discussion is going to be about first aid kits. Now, the issue of first aid is kind of a complex matter. I suppose a superior survival instructor would have a medical degree and be married to a nurse. And basically, you could almost say that much survival knowledge concerns medicine. I mean, how the human body functions properly and what interferes with that function. And so you think of all the sort of problems that you might have in the bush associated with what you carry and what you do, and then you try to be ready to deal with any type of accident. Of course, it's smarter to be trained so you don't have accidents, but that's called prevention. And it seems like it's a difficult and long-term situation to be able to be knowledgeable enough to never have an accident. So we go for first aid, which we call mitigation, and then you realize that in association with mitigation comes a period of recovery, which we call rehabilitation. So first of all, prevent accidents if you can help it. Second of all, when the accident happens, be prepared for that cut or that injury. And second, realize that once you have patched yourself up, it'll be a while before you can get back to normal. Now, the first thing that I'm big in favor for is to carry a first aid kit that fits in a pocket, a shirt pocket, and that if you don't have shirt pockets, sew them on, because that kit should be there somewhere, always on you, not back in your pack, where you might set your pack down and be miles away and have a bit of a problem. Now, what problems? If you're using a knife, you can cut yourself. If you're using an axe, you could chop yourself. If you're wandering around in the bush, the chances of poking yourself in the eye is very good. So it really would help in your kit to have things that address some of these basic things. So for example, if I carry a knife, my kit fits in my shirt pocket. But if I'm carrying an axe, there's a second kit that relates to an axe cut, because you might not be able to get enough stuff into one little package that will deal with an axe cut. And if you're handling a chainsaw, it's likely a fanny pack. If you're going to canoe down the river for a month, this is probably your first aid kit that the group has access to. So you got 30 people going down the river, and depends on the size of people, how much volume you carry, and so on. Well, at any rate, so you have a kit. Well, what do I like to see in my kit? You have to knock about enough that you develop these preferences for yourself on your own. And here I have, number one, I would say in this kit, is an ointment that's called polysporin ophthalmic ointment. And this is a very effective antibiotic ointment that can be used to injury in the eyes. Carry something that if you really do damage to your eye and eyes are so precious, you'd better address that. Well, another thing connected with the eyes is a mirror. Now, this can also be a signal mirror, and it can also be a mirror that will allow you to try to remove that object. It's a common thing to get little objects in your eye. I've had it happen to me countless times, so on. So if you have a mirror, it helps for you to be able to work on that. So that's an important part. Maybe more important to be carrying the mirror for eye injury rather than as signaling so much. Next thing, well, you have this antibiotic ointment, which costs 3-4 times as much as normal because they purify it to the extent that you can use it in the eye. But only one person in hundreds or thousands is sensitive to an impurity that's in this ointment, and it's so costly to remove it. Well, anyway, in emergency, you could use ordinary polysporin antibiotic antiseptic, but you can use this for anything less than an eye injury as well. So it'll handle everything. Then comes a type of pad that it doesn't stick to the wound. The one I'm most familiar with all my career, it's called Curad, but it's Telfa. And when you put that on a wound, and when it starts to smell after a day or two, when you peel that off, you don't disrupt the amount of healing that's going on. That is, it has the effect that it doesn't stick, so it's easy to remove. Third thing is that instead of stitches, you have these things that are called Steri-Strips. And the Steri-Strip does away with the need of carrying suturing kits. I used to carry suturing kits but never had the occasion to use one, and I could have used it on myself on occasion. But the sticky nature of the Steri-Strips is getting such that you can pretty well patch up everything on the surface using this exquisitely sticky, strong little bits of tape everybody knows them as Steri-Strips. 3M, the Minnesota Mining and Manufacturing Company, produces those. Then comes the Band-Aids. Well, my favorite is an H bandage that fits over everything, and in some cases when you're going light, the issue is that you have lots of these, and when you cut yourself, you put a circle of ointment around the wound and put a piece of Telfa pad directly over the wound, and then use lots of these to stick it on. And these conform extremely well to the knuckles. So generally, as far as Band-Aids are concerned, I carry nothing else. And with these, I just put enough of them that they will do a good job in staying in place and in sticking down and keeping the debris and all the other sort of stuff out of your wound. Now, another thing that I am partial to is a pair of tweezers. Spending a lot of time in the bush, you get thorns and slivers, and you generally find that it's hard to get quality tweezers, and you have to make them into functional tweezers by yourself. So you get whatever tweezer you can lay your hands on. Then you take a fold of sandpaper, you leave this at home, and you take the tweezer and keep rubbing back and forth. So you're sanding on both sides until finally that's as precisely aligned as it can be. And make sure that the tips of your tweezers are such that they're sharp enough to be able to dig with them, or else carry a sharpened safety pin. I always have one in my hat, but I examine the tip and sharpen it purposely and have it in my hat so it's always there, because it's so annoying to get a bad sliver in your hand, or thorn, or prickle, or whatever. And it's nice to have something to deal with it right away. But basically, you can take the worst type of tweezers you can imagine and tune them up very precisely this way. Now, that covers just about, well, it would be nice to have a lot of safety pins for both clothing and holding bandages on. But in the kit that goes in your shirt pocket, the rolls of tape are not there. Now, when you use tape, you usually use a tape that has no stretch to it. Some people like to have a little pair of scissors, and I don't know, I would say if I was packing a kit, I'd use the lucky number 7. So I'd have 7 Telfa pads and 7 H bandages and 7 of this, 7 of that. I also personally carry this, although some people will point out that you're not supposed to do this, but I used to generate very, very severe cracks in the fingertips and the thumb and so on. I would carry the super glue and I would seal off those cracks, because they're exquisitely painful once you get them. And generally that I would tend to carry that for my own personal use, although other people might not recommend it. Now, if you're wanting to carry some kind of material to wipe things down and so on, in the dollar store you'll find these compressed tablets that when you stretch them out make a remarkably large piece of fabric for first aid purposes. Very compact and very useful when you're trying to wipe sort of stuff up. And another issue, I might talk about how you handle wounds, because I think I have handled more cuts in my life than any doctor is ever exposed to in their practice. One story leads to, it's just a long story, but a person, there is a way of handling wounds, the most effective way, which we gained through a great deal of experience. Another thing that I'm really partial to in first aid kits, I have this material that comes in the blisters of the balsam fir. You can also collect a similar material out of any conifer by cutting a strip. But this stuff, if it's collected and kept in a bottle, it retains its fluid nature. And I would often say, and people might think that I don't know what I'm talking about, but this little bottle to me is worth a 5-pound first aid kit. This deals very effectively with burns and any type of extensive abrasion that can put red lines up your arms very readily. Medical profession might not use this as much as I do because they would be accused of practicing witchcraft, but I've never met anything that's so effective in dealing with burns and many other medical methods where you're worried about infection. You get a superficial burn, put this on, give it a good coating, in about 30 seconds the pain is gone, and a good coating, you put on material like this or fluff from the forest, cattail heads or whatever, and one day you look at all that and it's all gone because it looks very messy, but that's your first and last dressing, and I know nothing that you can buy in a drugstore that is as effective in keeping infection out of wounds and in dealing with burns, especially in dealing with the pain of a burn. Now you might have needles. Some people maybe even carry suturing needles, which may be in here, and generally having the dental floss and a needle for sewing, but the needle is there primarily for digging out slivers. Now there are many other things. Now we would maybe say that if I was going to carry a chainsaw or use an axe, maybe this is the axe kit that will deal with a good chop between the toes or whatever. That is, these type of bandages are kind of bulky. These can also double as emergency snowshoe harness. So we have enough of those, and then we have a good collection of Telfa pads and ophthalmic ointment and even a triangular bandage and so on. A lot of bandaging material that will allow you to deal with a pretty extensive cut. Now the kit, first aid kit, doesn't buy you everything that you need to know. You have to have some first aid to understand how you handle these emergencies, and then you construct your kit to meet your needs. For example, canoeing down the river with 30 students, this might be considered a small kit. I didn't pack this. This was put together by so-called professionals. Here you got goggles and rubber gloves. Then they have a scissors here. They say you could cut pennies in half. Someone started that situation that these scissors are capable of cutting a penny in half. But once you cut a penny in half, you likely can't cut anything after that. I might be more partial to something that looks like that. That is, this is cheaply constructed. This is a little more expensive, but on the road, you have a lot more. Here we will have more of the bandage, the roll type bandages, large pads for large accidents. There's even a thermometer in this particular. What's missing perhaps is a comprehensive first aid manual about all of these sort of things that you might have to deal with when you're off the beaten path. But someone, even Q-tips, someone put together a lot of things for school groups, blister dressings. There's even a hot and rapid cold pack. You might find that looking on the internet, you'll have a lot of medical wannabes who will come up with some pretty comprehensive kits, but I've never used anything. In my career of about 45 years of teaching survival, what I just described that fit in that kit was what I used probably 95% of the time. And maybe I might add something like that. But my focus always is that once I learn how to prevent an accident, so if we have axe skills, saw skills, any type of skills, knife skills, we find that we can teach people to not have to use big comprehensive medical kits, because it's better not to get hurt in the first place than it is to patch up afterward in an awkward situation miles away from a hospital and so on. But at any rate, understanding that you should protect the eye and keep everything sterile with regard to an ophthalmic ointment, the nature of the Telfa pad that doesn't stick to a wound, so when you replace a dirty old pad with a clean one, you don't disrupt the healing process, and then Steri-Strips that will close a wound. I once got a wound that ran from my ankle almost to my knee when I broke through the debris that was piled up with the Caterpillar tractor. When they were clearing a line, there was a barbed wire fence included in there, and I broke through one of the barbs, sliced me almost to the bone from my ankle on up to my knee. I never went to the doctor, but between the polysporin and the Steri-Strips, I managed to survive. I managed to not lose my leg, managed to keep quite happy because I knew how to keep such a disconcerting long cut as that sterile and do things to promote healing. If I had nothing else in the bush that would have put me into the lap of luxury to deal with such a wound using the contents from the blister of the polysporin. But I would say that if you are conversant with Steri-Strips, Telfa pads, ophthalmic ointment, and perhaps that, and then as a band-aid, it's up to you what you use. But my favorite is the H bandage that conforms so nicely to irregular parts of the body. Slivers being very prevalent, a good tweezer that has been sharpened so that the tiniest sliver can be pulled out. And that's what I sort of have to say about first aid kits.